Governor Brown, thank you very, very much. In Ohio, we also raised the smoking age to 21. We raised the age to vape to 21. We also started, for the first time, actually taxing vaping as well. And we're putting a lot of emphasis in regard to all addictions, in regard to education. We're doing something that's not been done, at least in Ohio, before, and that we've set aside $675 million for our schools for wellness and certainly social emotional learning. And this certainly, big umbrella would certainly cover vaping and the e-cigarettes as well as tobacco. Really, I think with the vaping, there's two separate problems. One's the immediate problem that we see. We've had about 100 people so far that we know of that have been hospitalized in Ohio with severe respiratory problems because of the vaping. That's what you see. That's what makes the news. But the long-term problem, I think, is much more serious. We have made some real progress in this country in the last few decades in regard to our youth smoking. The numbers have come down dramatically over that period of time. But in the last several years, we're starting to really completely reverse that. We're seeing up to 25% of our teenagers who are vaping becoming addicted to nicotine. And what we're seeing is they really have taken a playbook from big tobacco. They're using the same techniques that tobacco used for many, many years to addict young people and to get young people hooked. This is something that Matt Myers and I dealt with when I was in the United States Senate, and we tried to deal with those tactics. But these folks are very, very, very good. They're really addicting a new generation. Same tactics that big tobacco used. The fruity flavors. Doing all the things they could to make it look cool. They have a device that looks like a flash drive. Not only does it look cool, but it's also pretty easy to hide from parents or hide from teachers. So this has been a very, very sophisticated marketing technique that very tragically is working very, very well. I applaud the efforts the federal government has made. I think that's a good beginning. FDA can probably go a lot further, frankly, into kind of closing some of the loopholes that are there. But we're at least moving down the pathway. But this is just a huge health challenge. If we look at the ramifications of 25% kids becoming addicted to nicotine, and we know how very addictive nicotine is, that's a very, very frightening thing with long-term health implications and certainly long-term implications in regard to Medicaid, for example, and our Medicaid costs that we face in each state.